Hello, everyone. I'm Angeliki Makri, an experienced effectiveness manager at Pfizer. I'm thrilled to join the UX Healthcare virtual conference and share insights about how UX is reshaping the healthcare industry. So let's get started. Let's picture this. You're trying to book a doctor's appointment online, but the website feels like it's working against you. Or you are handed a stack of lab results full of medical jargon you can barely understand. Does this sound familiar? Experiences like this are all too common and they highlight how critical good design is in healthcare. What if scheduling appointments was as easy as ordering dinner on our favorite delivery app? What if medical data came with clear, actionable insights instead of leaving you guessing? Today, we will answer some of these questions through design, and we will also explore how thoughtful UX can reimagine healthcare in ways that empower patients and providers alike. Let's dive in. So before we dive into the topic, let me introduce myself. As I said, I'm Angeliki Makri. I'm an experienced effectiveness manager at Pfizer. My work focuses on creating innovation, human-centered solutions, and that bridge the gap between technology and healthcare. I have about over 10 years of experience in both UX and product design, and I have had the opportunity to collaborate on projects that improve patients' experience, sees optimize workflows for providers, and ultimately make healthcare more accessible for everyone. On a personal note, I have always been fascinated by the intersection of design and science. It's what drove me to specialize in healthcare UX, an area where design has the power to genuinely transform lives. I'm excited to share some of my insights today as we explore how UX is reshaping the future of the medical industry. So let's get started. Let's reframe the concept of patient-centric design. It's not just about the patient, but about recognizing the full ecosystem of care that surrounds them. By always placing the patient at the center, we are focusing on creating solutions that enhance the interactions and collaboration between the patient and everyone else that's involved in their care, like HCPs, nurses, caregivers, family members, insurers, and many more. As we design these experiences, we must account for all the different touchpoints and ensure that each player in this system can work together seamlessly to improve the outcomes for the patients. So, patient-centric design is essential because while healthcare systems vary across countries and regions, the core relationship between patients and their support network remain the same. The more we understand and empower these relationships, the higher the user satisfaction. Ultimately, this leads to better outcomes and long-term business success. After all, happy and engaged patients are more likely to adhere to treatment and return for further care. The benefits of adopting a patient-centric approach are clear. It starts with user-centered design that puts the patient at the forefront and offering personalized care based on their unique needs. Identifying unmet needs is crucial for delivering more effective solutions. With better design, patients are more likely to follow treatment regimens, and new solutions are adopted faster. This approach doesn't just help patients, it ultimately benefits healthcare providers and organizers too. When designing healthcare solutions, we often focus on one or two primary users. But even with this focus, we must consider that the vast differences in expertise and perspectives among those users. Here, we see a basic user journey from the moment the patient seeks a diagnosis to the start of their treatment. Each stage involves multiple users, and each is playing a unique role. For example, the caregivers are essential partners in this journey. They often help patients make informed decisions about their treatment. They're offering emotional support. They're also acting as intermediaries between the patients and the healthcare system. The nurses can step in with hands-on care during diagnosis and treatment preparation, while hospitals provide the infrastructure to deliver care at scale. And meanwhile, insurers influence decisions at a higher level, guiding what treatments are accessible and affordable for patients. When designing for this ecosystem, it's important to focus not just on caregivers and nurses, but also on HCPs, who ultimately make the critical medical decisions. Tools that empower caregivers, streamline communication with nurses, and support HCPs in delivering accurate and timely care can create a seamless journey for the patient, ensuring better outcomes for everyone involved. Empowering this relationship starts by understanding the user's background before jumping into solutions. By mapping the user journey, we can identify the right moments to intervene with the most relevant solutions. It's about designing tools that empower the right personas at the right time to improve patient care, ultimately leading to better patient outcomes. So, who are our patients? Let's take a moment and picture as an example an older adult. It could be a man or a woman. Um, what would that look like in your mind? Many of us instinctively imagine someone who fits a familiar stereotype, perhaps an elderly man or a woman with gray hair, wrinkles, and a walking cane. It's a common image shaped in our culture and personal experiences. But does this truly represent all older adults? How about someone looking like Madonna, Oprah, Mick Jagger, Angela Merkel? They are all the same age group that we typically associate with frailty and decline. And what do they have in common? They are vibrant, they are active, they are still very much leading impactful lives. This highlights how outdated our stereotypes about older adults fail to reflect the diversity within this group. When we design for older adults, we need to set these biases and recognize the broad spectrum of capabilities, experiences, and lifestyles they represent. Ageism is a real issue that affects how we design healthcare solutions. It is discrimination against older adults, often based on negative or inaccurate stereotypes. We might assume that all older people have poor vision, need a cane, or require special accommodations. These assumptions can limit our design approach, leading to products that are too simplistic or dismissive of their true needs and abilities. We have internalized the stereotypes so deeply that we sometimes fail to notice them. But in healthcare design, this mindset can create barriers to care, making it harder for older adults to use their very systems that are meant to help them. It's essential that we challenge these preconceived notions, designing for the full range of abilities and experiences older adults can have, from tech-savvy individuals to those who need extra support. When we compare older adults to younger adults, we notice some key differences in how they interact with technology and complete tasks. Older adults may take longer to learn new systems, perform more on memory intensive assignments. They also use different search strategies. They're also more easily distracted and they require more time to accomplish tasks. But these differences aren't just about age, they're about involving capabilities and the needs across different age groups, like cognition, motor function, socio-emotional factors, perception, and digital literacy all change over time. As designers, it's essential to recognize these shifts and adapt our solutions accordingly. By considering these factors, we can create experiences that are inclusive, intuitive, and accessible to users of all ages. The solution to many of these challenges lies in consistency, familiarity, and minimalism. Older adults benefit from designs that don't overwhelm them with options or constantly changing layouts. By keeping things simple and familiar, this builds confidence in using the tool. We should also Clickable items should also be clear and ambiguous. For example, buttons should look like buttons. Their purpose shouldn't be immediately obvious. Another key principle is allowing users to navigate at their own pace. Some users may need more time to process instructions to complete tasks, so designs should avoid imposing unnecessary time constraints and requiring quick actions. Recognition over equal is also critical too. Users shouldn't have to remember complex instructions or where things are hidden in their interface. Familiar icons, clear labels, and easy navigation reduce those cognitive loads. Finally, let's focus on feedback, which is a great example of how these principles come together. Imagine a healthcare app where a patient is scheduling an appointment, but skips selecting the date. Without feedback, the user might not be able to understand why they cannot proceed and could give up entirely. A good design provides immediate helpful error messages like, please select a day to continue. Similarly, a success message such as your appointment has been successfully scheduled reassures users that they have completed their tasks correctly. By following these principles and integrating strong feedback mechanisms, we create designs that guide, support, and empower users, especially older adults that are navigating healthcare systems. So, UX in healthcare. Now that we have explored the principles of effective design, let's take a step back and look how UX in healthcare has evolved over time. Understanding this evolution helps us see how far we have come and where we are heading next. The evolution of UX in healthcare has been a journey from systems focused entirely on providers to those that prioritize the patient experience. It started with physician-centric manual records where doctors were the sole owners and users of the patient's data. These paper-based systems were limited, often inaccessible to patients, and cumbersome to manage. We then moved to electronic manual records, a significant improvement that digitalized the patient information. While more efficient for providers, these systems were still centered around the HCP's needs rather than the patient needs. The introduction of wearable devices and telemedicine marked a dramatic shift. Tools like smartwatches and remote consultation platforms started putting patients in control and also allowed them to monitor their health and to interact with their providers on their own terms. Now we are in an era of AI and real-time monitoring, where healthcare is becoming more personalized and predictive. AI-powered platforms analyze vast amounts of data to provide actionable insights, and devices like continuous glucose monitors enable real-time healthcare tracking. This evolution represents a true collaboration between patients and providers. As we continue forward, UX in healthcare will play an even bigger role in bridging these advancements with human-centered design. So let's talk about why UX is essential in healthcare. First, efficient and user-friendly healthcare interfaces help reduce errors and improve care. In healthcare, even the smallest decision flow can lead to critical mistakes. A confusing interface on a medical device or a poorly designed electronic health record system could result in incorrect data entry or delays in treatment. With thoughtful design, we can minimize these errors and ensure safer, reliable care. Second, user-friendly portal and mobile apps encourage patients to take an active role in their healthcare management. When patients can easily navigate tools to book appointments, view test results, or manage prescriptions, they feel more empowered and engaged. For example, platforms like MyChart or patient apps that offer reminders and health tips foster a sense of control over personal health. Third, the Usability improvements save time for healthcare professionals, allowing them to focus on patient care. For nurses and doctors, time is a precious resource. When systems are intuitive and efficient, they spend less time wrestling with technology and more time where it matters most, caring for their patients. Lastly, improving the user experience can attract more patients, enhance an institution's reputation, and increase financial sustainability. Patients are now more savvy consumers. They notice the difference between a frustrating portal and a seamless one. Healthcare organizations can prioritize UX not only to improve satisfaction, but also to build trust and loyalty, and ultimately, driving long term success. UX is no longer a nice to have in healthcare. It's a, it's a fundamental requirement for systems, tools, and solutions that work for everyone involved. A strong UX strategy starts with understanding the target audience in healthcare. This means identifying unique needs for patients, providers, and caregivers. Next, UX research is essential to uncover pain points and opportunities. This helps ensure the solutions we design address real problems rather than assumptions. We also need to prioritize usability and accessibility. Features like clear navigation, large buttons, and inclusive language make tools more effective for all users, including those with disabilities or older adults. Iterative testing is crucial. Testing prototypes with real users allows us to refine designs and improve the functionality before launch. And finally, healthcare UX must always ensure compliance with regulations. Balancing privacy, security, and usability is critical for creating solutions that users trust and feel comfortable using. So, some predictions for the future. I think the future of healthcare UX is full of opportunities. For example, personalized mobile-first apps and digital therapeutics will empower patients with tailored health tools that increase engagement and satisfaction. VR and AR innovations will transform training, pain management, and even treatment, like using VR for surgical stimulations or AR for cognitive therapy. Wearables will make healthcare proactive, giving patients real-time insights and enhancing engagement. At the same time, data security and privacy will become even more critical. User-friendly features and patient education will build trust in the systems. Mobile accessibility and integrated analytics will also boost the productivity for healthcare professionals, helping them make faster and more informed decisions. Finally, HCPs will need to adapt to new technologies, ensuring that they stay ahead and continue providing excellent care. The future is about innovation, inclusivity, and bringing technology with human needs. Thank you so much for joining me today. I hope this session has given you new insights into the evolving role of UX in healthcare and how thoughtful design can truly transform lives. Now, I would love to hear your thoughts and answer any questions you may have. So let's discuss.
So, thank you for that, Angeliki. I don't know if you can hear me.
Thank you. Yes, I can hear you. Thank you very much.
Great stuff. I don't know whether you can actually share just with your current role of what you guys are working on in Greece at the moment and what's the main focus.
Mm-hmm. Look, I cannot share too much specifically about projects, but generally what I can say about Pfizer is that it has invested a lot in a digital center in Thessaloniki, where we are building a very, very large variety of products that either help the whole user experience in a company with the medications that's actually selling, or it's creating applications that completely transforming the market, whether that's AI or any sort of more specific healthcare-related market. I hope this is giving a little bit of insight.
Yeah, no, thank you for that. We have a question here. I don't know if you can see it on your side.
Let me see.
I'll just read it out. It's from Byron.
Yes, please. Mm-hmm.
And his question is accessibility ADA compliance addressed in all corners of the world?
I think accessibility is the key, especially when we are talking about healthcare. We can find it everywhere from our day-to-day things we're doing. Accessibility is key, and it's improving our experience, or even if you look into healthcare. It doesn't matter where you are in the world. I think there's always some factors that that affect accessibility, and considering them as well as the level of accessibility of each individual that we're designing for is key before we dive into designing solutions.
Sorry, I keep on muting myself. Byron, I hope Brian, I hope that answers your question. Yeah, thank you for that. I really do appreciate it. That was great insight from you. How can people reach out to you if they need to get hold of you?
I do have a LinkedIn account, so you can feel free to reach out there if you want to.
Okay. I don't know. You can read the comment there. I think Maria's also got a question in the comment section there.
Yes. What potential unintended consequences of that?
She's just curious on the potential unintended consequences or ethical challenges have you already seen emerging as these innovations scale?
Yes. In order for example, when it comes to AI solutions, I have seen that the ethical topic is it's very much there. Of course, in order to educate the AI systems that we're creating, we need the medical data. But from the other hand, the medical data seems to be private, of course. It's tied to the individual, to the patient. So it's a little bit tricky of finding a way where we're also collecting this data, of course, with the consent of the patient. At the same time, we're informing all of the products we are creating, and we're kind of improving them based on everything we are collecting. So there's a lot of ethicality going on in there, how you're collecting your data, whether you're transparent with the data you're setting. And also another thing that I have noticed is a lot of patients tend to give their data when they can see the immediate be collecting data just to inform your own products. But for example, I have seen some products in the market, not specifically with Pfizer, that are, for example, giving back to communities. In that cases, patients have been more open sharing their data because they feel that they contribute to a bigger audience, a bigger picture, if it makes sense. So that's the way I have seen people handling this. Okay. All right. So personalization, I see there's a question now answering. Since health UX is becoming more personalized, how do you balance personalization with privacy? All right. So Personalization has to do with tailoring the actual product to the patient. The previous example also applies, I think, here. In some cases, people tend to well, there are many ways you can convince people, first of all, to provide their data, which is one key step in order to be able to personalize anything. And then the next step is the matter of personalization. Personalization could either come from generic research that's publicly available, or it could come from the data that you personally collect from that individual in order to make it even more personalized. Either way, you always need to be balancing out and asking, and first of all, informing them how you're planning on using that information, and also asking them to allow you to use it. And in a lot of cases, providing options, it's a good approach. Because some individuals might still like to provide their data, but they would like not for them to be used in some ways, but prefer other ways. And always, I think once you collect the data, always showcasing the impact those data that they have shared have to the individuals that have contributed them is one of the I think one of the most important steps within the whole data sharing journey. I hope this answered the question.
Thank you for that. And then we have one from Missy. I don't know if you can see it. It just popped up on your screen.
Anyway. Okay, so the question says, how can we make sure everyone can benefit from these innovations considering cost barriers like wearables? Not all products, of course, are for wearables. The majority of products I think that are out there are for mobile devices. Of course, wearables can add a little bit more value, but I also see that the actual mobile devices have been getting even more advanced. So a lot of things like, for example, monitoring your heartbeat, I think a lot of things like this can already be done through your mobile phones, and you do not need your wearable in order to complete that. Also, how to make sure everyone benefits from these innovations because of cost barriers. Yes, so I think that's it. Then when it comes to the actual wearables, it's a nice to have addition. I would say that. I hope this answers your question.
Okay, great stuff. Thank you so much. Ladies and gentlemen, we're going to jump on to our next speaker, Sharon. Hopefully we'll be able to see you in the US, Angeliki. We can do this in person. I know someone asked the question why we're not doing it in person. And there was a whole lot of logistical issues, but we definitely... Oh, on that note, we have one of our speakers, Amy's joining us on our closing session for tomorrow. Amy's actually running an event in Atlanta in June. So if you want to support her, she's actually doing that event. So it's a great way of actually just getting the community. And it's also around healthcare as well. So